Hi there, I'm Jamie Taylor, and welcome to Your Health Matters, brought to you by Kingman Regional Medical Center, your community-owned not-for-profit hospital. I'm excited to bring you these shows that are going to be providing you information about health issues that either you or a family member may be dealing with right now. We're lucky to have great healthcare professionals here at Kingman Regional Medical Center, and they're going to be on the show. My guest today is Dr. Wilson Otero. He's a gastroenterologist here at KRMC, and we'll be talking about that infamous colonoscopy and colon health. So stay tuned, don't go away, we'll be right back. Welcome back to Your Health Matters. I'm Jamie Taylor, and today the guest on our show is Dr. Wilson Otero. He's a gastroenterologist here at Kingman Regional Medical Center, and we're really excited to have you on the show today, Doctor.
Good morning.
Good morning. Thank you.
Thank you for having me.
You're welcome. It's our privilege. So we're going to talk today about colon health and that infamous colonoscopy. But first I want to learn a little bit more about you, because I know you're fairly new to Kingman. You and your wife moved here how long ago?
We've been here 5 months now.
5 months already. Wow, time flies.
Time flies.
And where did you come from before?
Well, it's been I've had a long history in GI,
yeah.
but I moved here from Florida where I had a private practice.
Okay.
And the kids grew up, they left their home, and it was time to move.
Go to a less humid climate maybe, or what brought you to Kingman?
A dry climate, a pretty scenery, and friendly people.
Good, yep, I think Kingman's a very friendly town. We love it.
My wife and I are enjoying it.
Good, I'm glad to hear that. And where did you get your education?
Well, I'm a product of the public schools in New York City, Brooklyn and Manhattan. Then I went to Princeton University in New Jersey. After that, I did my medical training at Temple University Medical School in Philadelphia.
Okay.
I worked in various places, and I did my fellowship in gastroenterology at the University of Rochester.
Okay.
In Rochester, New York.
Okay, so East Coast kind of guy.
East
now
Coast,
you're over
yes.
on the West.
No, I'm in the West, and I'm quite happy.
Good. Well, like I said, we're excited to have you here. I know you're an awesome part of the KRMC team, so welcome. We're going to talk today about colon health. Before we get started, I wanted to share this little video clip. As you know, we're a partner with Mayo Clinic, and they have this program called Medical Edge. And we're going to show just a quick clip from there about the colonoscopy.
Colon cancer is a deadly disease that, thanks to screening tools, can be prevented and cured if caught early. One of the current ways to look for cancer or precancerous polyps is with colonoscopy. That's the test during which doctors use a scope to spot and remove polyps, which they send to a lab for diagnosis. But now a new technology allows doctors to determine if you have precancerous polyps without having to remove them first. Doctors at Mayo Clinic say it could save many people from having unnecessary biopsies. As a gift to himself, John Levchuk got a head-to-toe physical exam. It included a colonoscopy.
They took out 20 different polyps.
The only way John's doctors could tell whether or not the colon polyps were precancerous was to remove them and send them to a pathology lab for diagnosis. Polyp biopsies are a very good way of diagnosing cancer, but studies show that half of them don't need to be taken out because they're benign. Research at Mayo Clinic shows that a new technology can detect and diagnose colon polyps without having to remove any tissue from the body.
This new virtual biopsy technique would allow us to look at polyps very precisely while they're still in the colon and make a diagnosis if it's precancerous or not precancerous.
Here's how it works. Dr. Michael Wallace guides a colonoscope equipped with a camera and a tiny probe-based microscope into the colon. Once there, he can identify polyps and use the microscope to look at individual cells. If the cells look normal, the polyp can stay. If it does have precancerous changes, he can take it out and prevent it from developing into cancer.
This sample is almost certainly a cancerous sample, not even a precancerous.
Dr. Wallace says the technology may eliminate the need for unnecessary biopsies and benign polyp removal. And that's good news for the thousands of people like John who get screened for colon cancer every few years. Another potential advantage that Dr. Wallace is studying now is cost savings that could arise from not having to perform so many biopsies. And John says he knows colon cancer screening saves lives, and he hopes this technology will encourage more people to have the procedure. This technology is being considered for use for other types of cancer screening as well. For Medical Edge, I'm Vivian Williams.
And I know every hospital and doctor has different ways of doing things. So let's talk about the colonoscopy. And here at KRMC, I mean, I know colonoscopies are kind of a scary thing for people, but I just had one. It wasn't that bad.
You know, I think that there's a lot of myths involved with colonoscopy, but it's a very straightforward examination which is user-friendly. And it's something that's very, very necessary, because among the top cancers that are affecting the population are the problems with the colon.
Okay.
And a timely colonoscopy can save your life, not only because you can detect something when you do the colonoscopy, but also it gets rid of anxiety. People worry, maybe I have something, maybe I don't have something. And when you have a timely colonoscopy, you lay the matter to rest.
Okay. So when should a person have their first colonoscopy?
Well, there are a variety of situations. To the average person who does not have a family history of colon cancer, who doesn't have a family history of colon problems, we recommend colonoscopy at age 50.
Okay, that's when I had my first one.
That's a vast majority of people. And if the colonoscopy is completely normal, we now know that we can wait 10 years before the next colonoscopy.
Yep, that's when I had my second one. No.
People usually worry about pain, and that's not
No.
a major problem because we give them medications. They worry about the bowel preparation because you have to drink a lot of fluid. But recently we've developed new ways of cleaning the bowel. We're using these medications here at Kingman, where we can give you half the volume of preparation. And we have a very good examination, usually within 15 to 20 minutes. And the risk is very, very low. Perhaps 1 out of 1,000 people may have a mild complication.
That's pretty low.
We have the latest equipment. The equipment here is no different than in Boston or in New York City.
Great.
We have top-of-the-line equipment with top-of-the-line assistance.
Good. I tell people all the time that that's one of the benefits of KRMC being a not-for-profit facility. The monies that we make go back into our hospital versus shareholders, and so it allows us to have state-of-the-art technology. And you just said what I tell people all the time that other hospitals would give their eye teeth for.
I believe so. And one of the reasons I came here is because it's not for profit. I feel strongly that medicine should be provided to an entire community. And once you get rid of that profit motive, I think we can dedicate ourselves to quality and humanity and humane care.
Right, and that's very important. So colon health, I mean, there are other things besides the colonoscopy, obviously, that have to do with colon health.
Well, gastroenterology has a lot of things.
Right.
It goes from the mouth all the way to the other end.
One end to the other.
So we deal with problems of eating, problems with swallowing, problems with reflux, with GERD, problems with any type of malignancy or problem with the esophagus. Sometimes people don't have enough saliva. Sometimes their mouth is too dry. Sometimes they have a little bit of a stricture that they can't swallow properly.
Right.
We can address those problems. The more frequent ones are reflux, hiatal hernias, gastritis, all the stomach problems, including ulcers or more serious problems with the stomach, problems with the small bowel, Crohn's disease, bleeding from duodenal ulcers. We can inject, we can cut, we can remove, we can photograph, we can sample, so that in modern medicine we're trying to arrive at a diagnosis. And before you go to the operating room, before we do anything more serious, we can do simple tests that give us a lot of information and protect the patient. One of the most important exams is the colonoscopy. Because it's one of our most common malignancies. And we now know that if you do the colonoscopy correctly and on schedule, on time, you can save millions of lives.
Well, you were sharing with me the other day when we were talking about how you did a colonoscopy and found this very small, minute, that looked like a grain of rice. And
well, last week we had a man who'd had polyps in the past, and I saw a little thing about maybe the size of a grain of rice, and it was a cancer.
so you
But
caught it
it's
early.
been, we caught it early, and it's been resolved,
Great.
and he will not need surgery.
Oh, he doesn't even, so you were able to take care of it right there and then? when you-
Yes, yes, yes.
Awesome. So that, again, that just shows the importance of catching it early when it's still small.
Catching it early and realizing that it's something that's preventable.
Right.
That we've come a long way in the last 30 years, and that a diagnosis of something potentially bad does not mean loss of life. It doesn't mean a colostomy. It doesn't mean disfiguring surgery.
So the
It's
quality
something-
of life is still able to
We
be
can
there.
preserve function and give the person potentially a normal lifespan.
That's wonderful. That's wonderful. So you were mentioning all of those other things like GERD and Crohn's disease, and see a lot of all of those different things here in Kingman so far?
We have a community that's very interesting. We have everything here. Everything you find in New York, you find here. Everything you find in Florida, you find here. The question is finding it. You have to see the patients, examine them, and look for this pathology. There's an important part of this that I haven't mentioned. In gastroenterology, we have a group approach here at Kingman. I'm working with dietitians, I'm working with the exercise department, the physical health department, to try to control the more common problems.
Such as?
High cholesterol, high triglycerides, obesity, the problems related that come from poor nutrition or from overnutrition. So we're not only seeing the GI problems, but trying to refer people so that they can get help with their diets and with their exercise. Reflux is one of them. As we lose weight and as we change our diets, the symptoms seem to get much better. So that it's a joint venture. Many of the patients ask me, what can I eat, doctor? What should I eat? And we can refer them to a dietitian and help them
Great.
with their dietary plans.
Right, we do have that full gamut here at KRMC. Like you said, we have a great the nutritionists and our registered dietitians.
We have people that have sprue who need special diets.
What's brew?
Sprue people who can't digest certain types of grains
Oh, okay.
that might be predisposed to diarrhea, but it's an illness.
Okay.
And they need very specific diets, and they need instructions from a dietitian. We have people who have high cholesterol, so they need special diets.
Okay.
People who have high blood pressure, diabetics, and they have GI symptoms, and the diets help.
Wow. That's, I want to talk more about that. I think that's really important for our audience to know more about. So we're going to take a break here, have a couple of messages, and we'll come right back and talk about that more, okay?
Very good.
Thank you. Stay tuned. We'll be back shortly with more information about your colon health.